All right, so shoulder eval for the semester C competency. Why are you laughing? It's okay. All right, so, oh my gosh. I will start by taking a past and present history using OPQRST and sample, OPQRST, onset, provoke, quality, region, radiation, severity, time, and then sample, signs and symptoms, allergies, medications, past pertinent medical history, SAMPL, last oral intake, and events leading up to the injury. Then I will inspect for any swelling, discoloration, deformity, and their posture, the shoulders if they're equal or uneven, the turn around, more scapula or scapulae for any winging, as well as any atrophy or hypertrophy, and also if the arms are hanging equally or if they're uneven. Then I'll start with bony palpations. Turn around again. So I'll palpate the clavicle, I'll palpate the clavicle, the sternoclavicular joint, the acromioclavicular joint, and the humerus. Turn a little to the side, the head of the humerus, as well as the bicipital groove. Then for the scapula, turn around. Yeah, you have a shirt on, so it's okay. I'll start with the acromion process, the coracoid process, which is on the anterior side. Yes, you can see that. Acromion process, coracoid process, the inferior angle. The inferior angle, I'm trying to feel your scapula. Inferior angle of the scapula. The inferior angle, the medial angle, the medial border, lateral border. Sorry if that tickles. I'll go softer. The spine of the scapula, and the supraspinous fossa in the spine of the scapula. Next, I'll move on to soft tissue palpations, beginning with the rotator cuff muscles. All right, turn a little. Oh no, yeah. So sits supraspinatus, infraspinatus, teres minor, which is below that, and the subscapularis is like underneath the scapula on the anterior side, and it's hard to palpate. What else? Oh, and for the deltoid, turn this. Yeah. So for the deltoid, I'll palpate the anterior, middle, and posterior deltoid. Then I'll palpate the pec major and minor. Pec major, pec minor. Then traps. So for the trapezius, I'll palpate the upper, middle, and lower traps. Then rhomboids, the major and minor. Then I will palpate the latissimus dorsi, which is kind of big sheet muscle here. Then the biceps, and the coracobrachialis, which is kind of difficult to find. Then the levator scapulae, this angle here. And then the levator scapulae and the serratus anterior. Then we'll check range of motion. I'll test it both passively and actively. In this case, I'll have you do it actively. So let's go, turn around, face the camera. Start with, so flex, you're gonna do what I do, okay? So arms to the side. You're gonna go flexion at 180 degrees, face the camera. Flexion at 180 degrees like that. Or all the way. Yep. And then extension at 60 degrees, so far back. Yep. Don't bend your, keep it body. Yeah, supine, and yep, nice. And then abduction at 180 degrees, so out to the side. Oh no, start like this. Use that arm. Go to the side so you don't hit me. Up, nice. And then adduction at 45 degrees, so inward, so like this. But like this, like you're doing a chest. Yeah. Okay, and then let's see what's next. Yeah. Adduction. Oh, scapular elevate. So turn around. Or no, you don't have to turn around. Scapular elevation, do this. Scapular depression. Yeah. No, see how you go forward? Go down.
I can't.
Yeah, you did it. Scapular retraction. And then protraction. And then really try to like, ooh. Nice. And then and then internal and external rotation, both at 90 degrees. So I'm actually gonna, or internal, external rotation. Oh, so actually you're gonna go like this, and then external rotation, internal rotation. Nice. All right, and then external and internal rotation are also called medial and lateral rotation. Next will be muscle actions with resisted range of movement. So we'll start with flexion. All right, so you're gonna push up against me. Okay, go. You're gonna go that way. Go. Push. So that's flexion, and that's for the pectoralis major, anterior deltoid, and biceps. Now we're gonna go test the extension. Go. You can keep your arm facing. Go. Nice. And so that's for the latissimus dorsi, the teres major, and the posterior deltoid. Next will be abduction for the supraspinatus and the middle deltoid. So push. Go. Push.
Which way?
Up.
Oh.
Yeah. All right, so that's abduction, and then adduction. You're gonna pull against me. Go. Nice. And so adduction is gonna be for the pectoralis major and the latissimus dorsi. And then internal rotation, you're actually gonna stay here this time. So you're gonna go pushing against me. Well, yep. Push. And external rotation. Push. All right, nice. So internal rotation was for pectoralis major, the subscapularis, the latissimus dorsi, and the teres major. External rotation was for the infraspinatus and teres minor. Next we have horizontal adduction. So you're gonna go out here and you're gonna go push. Yep. And so that's for the anterior deltoid, pectoralis major, and the coracobrachialis. Next we have horizontal AB abduction. Push. Go.
Which way?
Actually start here.
Which way?
You're gonna go. Push. Nice. So that's gonna be for the posterior deltoid, the latissimus dorsi, and the teres minor. And then for these ones, you're not gonna resist against me. You're just gonna do them actively again. Like just do what I do. So scapular abduction and upward rotation. So you go like this, up, forward, and then that's for the serratus anterior. Next is shoulder elevation. For the trapezius and levator scapulae, scapular adduction, which is kind of just like this. Yep. That's for the middle trapezius and the rhomboid major. Then scapular depression, so down, and adduction, and then back. Nice. And that's for the lower trapezius. Next is scapular adduction and downward rotation, so kind of rotate down and do that. Yep. And that's for the rhomboid major and minor. Next, we're gonna do neurological. We'll start with motor. So deltoid C5, do this. All right, so like this. Go down, and then deltoid works. And then C6 is gonna be wrist extensor group. Go like that. Then C7 is gonna be triceps. Flex your tricep. Yep. And as well as wrist flexors. So down, or you go and then flex. Yeah, nice. Wrist flexors and finger extensors. Nice. And then so C8 is gonna be finger flexors. That's flexing your fingers. Nice. T1 is finger AB and adduction. So abduction and adduction is just this. You can spread them out. Yeah, nice. Next is going to be sensory. So C5 is going to be the anterior central lateral arm. And then C6 is going to be the thumb.
You're not showing.
Oh. C5, C6, C7 is going to be the middle finger. That's your middle finger. Yeah. C7. Oh no, C7 is the third middle finger, and then C8 is going to be the fifth little finger, and then T1 anterior central medial forearm. Reflex, we have the All right, relax. We have the bicep tendon reflex, as well as the brachioradialis tendon reflex, C6, and then C7 triceps tendon. It's going to be, I'm going to go here. Up, relax. And then blood flow test, radial pulse. Oh, I actually have to take this. I have to use your timer. Is that okay with you?
That's the wrong way. You swipe up.
Oh.
Did you put me on mute?
Let me see here. Let me find it first. Relax. There I found it. Take it for 15 seconds. Dang it, I lost count. Let me restart. All right. All right, so I got 22 times that by, let's see, 22 times 4. So I got 88 strong and regular. Then recapitularization test, or the Allen's nail bed test. Let me see your fingers. This color should come back within 2 seconds. If they have nail polish, then you just do it that way. Then I would compare bilaterally.